Welcome to the MamasteFit YouTube channel. If you've been having any sort of rib pain during your pregnancy, I'm here to give you some tips to help find some relief. Hey, my name is Gina. I'm a perinatal fitness trainer and birth doula, and I'm here to share some tips on how you can be more comfortable during your pregnancy. But before we dive into the exercises that you can do to find relief during your pregnancy, I want to share that my book, Training for Two, is now available for pre-order. Training for Two is all about how you can use prenatal fitness to stay strong throughout your pregnancy with trimester by trimester lifting modifications, pain-free, because pain is not a requirement of pregnancy, with pelvic stability and core exercises, and also tons of exercises to help you find relief from common issues and discomforts during pregnancy, and then also to help you prepare for birth with pelvic opening and pelvic floor release exercises. You can check out Training for Two down in the notes below, and the book comes out September 10th of 2024, a little bit after this baby is born. And so I am currently pregnant with my fourth baby, and I've been having kind of similar discomforts from pregnancy to pregnancy. And one of them is rib pain right here on the right side of my body. And so for me, the issue of why I have this rib pain is due to compression on the right side. So one of the reasons for rib pain could be due to the normal asymmetries that we have within our body. Commonly, we like to put more weight into our right leg, known as a right stance, because the organs are denser on the right side of our body. The diaphragm is bigger on the right side. The organs are a lot denser, and so we just feel more stable on the right side. And because of this, the left hip tends to sit a little bit more forward as the right hip kind of shifts backwards. And then this translates to this asymmetrical positioning throughout our upper body as well. And so because our hips are a little bit more oriented towards the right, when we're rotating towards the right side, we tend to twist a little bit to the left to help kind of counter that rotation. Because of that, we tend to be a little bit more compressed on the right side body and lengthened on the left as we've kind of twist and open up away. And so this is a very exaggerated posture, but during pregnancy, we tend to sink a little bit deeper into some of these positionings as well. And so if you favor this postural tendency, you may have more right side rib pain due to that compression. And so I'm going to go over a few exercises that you can do to find some relief. A lot of the exercises that we can do to find relief from right side body compression involve side body openers. And so we're essentially going to be finding this stretch and lengthening through the right side body. The first one is this seated side body opener. So the feet and the knees are going to be stacked. I'm going to be seated more on like that right hip. And then I'm just going to kind of sink into the shoulder and allow there to be a big stretch through the right side body. And so from here, I can already feel that area that feels a little bit more tender stretching for me, but I can move a little bit deeper into it. And so I can reach forward with my left arm, not to try to touch the wall in front of me, but rather to push my back to the wall behind me. And so I'm trying to push my chest away from my hand, and this is going to bring me deeper into this stretch. And so from here, I can then think big inhale to try to feel these ribs kind of expand from one another. And then exhale, try to like crunch a little bit more on this left side to stretch even more on this right. And so you can stay here for about 30 seconds, for a minute, but roughly around 10 breaths is a really good goal to help kind of stretch this right side body. The next exercise that we can do is going to be in a 90-90 position, and this is going to take the hip asymmetry into consideration. So commonly, we find this position to be more comfortable, where the left leg is in more external hip rotation and the right leg is in more internal hip rotation. But we want to kind of position ourselves in the opposite, where the right leg is more externally rotated and the left is more internally rotated. And so it will probably feel a little bit more uncomfortable to be in this position. And so from here, I'm going to reach my right hand up and then lean towards that left side to, again, feel that big stretch through that side body opener. But I'm also going to feel a little bit more in the groin of this left hip as well, as I kind of sink deeper into internal hip rotation over here. Now you can reach a little bit forward of that left leg, and then I'm kind of reaching more diagonal in front of me. And then same thing, I'm kind of like pushing my back to the wall behind me to breathe here. So big inhale to feel that right side body expand. And then exhale like I'm trying to crunch more on this left side. After that, we can get a little bit more dynamic with it. So I can bring that right hand behind me to extend in that left hip to get a little bit of a hip flexor stretch, because typically that left hip flexor is a little bit tighter. Sit back down and then find that side body opener, stretching that right side and just alternating between the two. So sometimes finding a little bit more movement can help us warm up a little bit more to release some of that common area of tension as well. Another exercise that we can do to help kind of stretch and come out of compression on the right side is going to be the archer press. And so I'm going to hold the band in my right hand because this is the side that I want to target. And then I'm going to step forward with my right foot. And so now I'm going to be coming into a hip shift on this left side. And so from here, I'm going to reach forward with that left hand. And then as I press, I'm going to come across my body and kind of crunch towards that left side. So again, finding that same side body opener on the right, and then shifting my weight into that left hip. So I'm taking weight in that big toe. I'm kind of twisting and rotating towards that left side, compressing on that left side to find some more length on the right. And so this is a little bit funky, but it's more upright and a little bit more dynamic. And so you may find that it helps you find a little bit more of a release. So you can just breathe here to start for about 10 breaths. So big inhale to feel this kind of right side body lengthen. And then exhale, press a little bit more as you crunch onto that left side. And then we can get a little bit more dynamic with it, where I'm reaching forward with that left hand as I bring that band back towards my shoulder. And then exhale to press to kind of find that same stretch on that right side body. And then just going back and forth between the two. The last way that we can advance this is I can step back with that right foot and kind of step into it to add a little bit more momentum. But what we're focusing on here is kind of countering our normal asymmetry that we tend to have, where the right hip tends to be more internally rotated. So in this position, it's the opposite. And same with that left leg, which tends to be more externally rotated. Here, it's more internally rotated in this closed hip position. Finding more length in that right side body and more compression towards the left, which again is usually opposite for us. So there's a lot of exercises that we can incorporate into our prenatal routine that are both mobility and strengthening to help us counter a lot of these common postural tendencies that we have that may be contributing towards some of that prenatal discomfort. In my book, Training for Two, I break down a lot of common prenatal discomforts and solutions for all of them because, again, pain is not a requirement of pregnancy, but I hope that these exercises helped you figure out some movements that you can do now to find some pain relief and be more comfortable while we're pregnant. If you want more support throughout your pregnancy, check out our online prenatal fitness program. Our online prenatal fitness programs are designed to keep you strong throughout your pregnancy, pain-free, again, not a requirement of pregnancy, while also helping you to prepare for birth. We've designed our online prenatal fitness programs from working both with in-person prenatal fitness clients and online clients. So we didn't design the programs just because we were pregnant and decided to write this program. I have my master's in exercise science and an in-person training facility here located in Aberdeen, North Carolina, that I've been working exclusively with prenatal clients for the past 7+ years. In addition to being perinatal fitness trainers, we're also birth workers. And so I'm a birth doula. Roxanne, who's my sister, is a labor and delivery nurse and student midwife. And so we've really combined our expertise both in the fitness realm and in birth to help create this program to help support you from conception all the way through birth and beyond. In addition to our prenatal fitness programs, we also offer online childbirth education courses to teach you what is actually happening during birth by teaching you the science of birth. So you'll understand what is a contraction, but also what are your options during birth, and how can you move throughout your labor to make the process a little bit easier. You can check out all of our prenatal support courses on our website at MamasteFit.com and use code YouTube10 to get 10% off. I hope that these exercises help you find some relief, and if you enjoy this video, be sure to like and subscribe to our channel so you get notified whenever we release new videos like this.